So let's talk a bit more about vaccines here at the European Health Summit. And we're talking to Dr. Michel Goldman, who is founder and co-director of I3H. That's the Institute for Interdisciplinary Innovation in Healthcare. You're also you are a knowledge partner of the European Health Summit. Dr. Goldman, you're a professor of immunology at the Université Libre de Bruxelles. And you are also first executive director of the Innovative Medicines Initiative, the IMI. Could you give an example of a vaccine innovation that IMI brought to patients?
Of course, IMI has been instrumental in the development of two vaccines against the Ebola virus. And you know, this was also a terrifying pandemic in Africa. And IMI not only helped to develop those vaccines, but also to develop diagnostic tests for the disease. And as you know, those are also the main challenges we are facing with COVID-19.
Indeed.
Diagnostics, prevention through vaccines, and also therapeutics.
Okay, so let's talk about the vaccines for coronavirus. As a professor of immunology, how safe do you think these vaccines are?
I think it's very important to realize that among all pharmaceuticals, vaccines are probably the products for which safety is really considered with the most stringent rules by those who are developing vaccines, but also by regulatory agencies. Having said this, I think it's important to realize that very rare side effects will only be visible once millions of people, or at least 100,000 of people, have been injected. And sometimes, indeed, very rare events can develop, should be identified rapidly, appropriate actions should be taken, but it's very important to make the balance between this risk, which is still theoretical for current vaccine for COVID-19, and the real risk related to the disease, of course.
Okay, right. So you're relativizing it, but what about all these millions of skeptics in Europe? We see almost roughly half the population in France is skeptical about the vaccine. What do you tell them?
Well, that's a major challenge. You know, it's quite interesting. Science delivered at an incredible pace. In less than a year, we have now several vaccines. And still, we have major challenges to have these vaccines reaching their objective. And one of the major challenges is indeed vaccine hesitancy, or even people, as you said, who are just trying to convince that vaccines are not the way forward to fight the pandemic, which they clearly are. And I think that to fight this skepticism, there are two key elements. The first is transparency. We must be extremely transparent about all the knowledge that has accumulated and that will continue to be built around vaccines. And it's transparency from all stakeholders, starting obviously from the vaccine manufacturers, but also the public health authorities, and also scientists has a very important role to play to explain indeed what they certainly know, and also the question which are still pending. And the other key element, which is important not only for these COVID-19 vaccines, but for future vaccines to be developed, is education. We have really to work hard to make our citizens much more, I would say, vaccine savvy. It's a question about introducing health literacy as a major objective of all our education program, starting, you know, in primary schools.
Sure, yeah, and that takes time. But you're talking about transparency. What do you do about patients who remain susceptible even after vaccination?
Yeah, that's a very important point. You know, even if those vaccines are extremely efficient, we will still be left with patients for different reasons. Their genes, it might be other disease they are suffering from, drugs they are taking. And some patients indeed will not respond the right way to the vaccine. And for these patients, it's very important to pay attention to antiviral therapeutics. So those are drugs which directly target the virus, and they might be extremely important, for example, for older people in nursing homes. And do, for example, antibodies against the virus are currently developed by several major companies. Actually, there is an antibody race which parallels the vaccine race. And I think it's important that Europe pays more attention to these aspects.
What percentage of the population needs to be vaccinated for it to be effective in knocking down this pandemic? There must be a certain percentage you have to reach, no?
Yeah, there are still question marks. I will not enter the details. It's probably somewhere between 50 and 70%.
Okay,
but
so
the important point that we should realize is that the first objective that we will reach through vaccination campaigns is to protect our citizens, our patients, for the most severe cases. This is something that we certainly can affirm today. We are not sure that all vaccines will be able to really control the transmission of the virus. So the virus will stay around, but what we can say is that those vaccines should prevent most of the most severe cases, which means that those vaccines will protect our hospitals and will protect, obviously, our citizens from the more dramatic cases.
where do you stand in this debate on whether to require people to take this vaccine or not? I mean, if you have to reach a certain percentage of the population that receives the vaccine for it to be effective, should it not be required?
I don't think that at this stage to make vaccination compulsory is the right strategy. I think, as I said, that we have to work hard to explain why vaccines are important, and explaining that it's important first to protect the vaccinee, him or herself. I think that obviously vaccination is an act of solidarity, but I think that we underestimate the risk that everyone actually can face with the disease, even young people. And in Belgium we are now talking about even very young children with the disease. Those are very rare cases, but they are there, and I'm sure that once we will have more people protected by vaccination, we will realize these few cases which can be rather dramatic. So we have to say to the people, first protect yourself, even if you don't consider that you are at risk. The risk to get the disease is real, even if it's slow. That's point number one. And second is indeed by vaccination, you will also protect people who are in your family, around you. And also by doing so, you will act as, you will do a very important act for the society itself.
Okay, but it's not the panacea, it's not the silver bullet, this vaccine, the vaccine or the vaccines. So what precautions should be taken even if somebody gets vaccinated?
Yeah, that's a very important question. And I think that's a risk that we will face actually in coming months, if not weeks. People might think that because vaccines start to be deployed, that we are close to the end of the lockdowns and all these measures which make our lives so difficult. That's not the case. It will take months, if not years, before we will be fully protected by the vaccines.
But how do you
sorry?
But how do you envision a gradual lifting of these restrictions? How much should we lift the restrictions on business activity, on personal movement, once that vaccine is taken by, say, at least half the population?
Yeah, the lifting of the protective measures should be progressive. We have to follow, obviously, the circulation of the virus. We have also to follow the response to the virus, the immunological response to the virus in the population. And we must be indeed careful. But I think that if we do it progressively and we explain, if we explain why we do it progressively, it will work. And I think that the most difficult measures that we are living with, including the lockdown, I think that quite rapidly we will be able to lift those most difficult to live with measures.
And we have the holidays coming. The vaccine is going to be rolled out over the next few months. People are going to be getting together again in these next few weeks. How much do you fear a third wave before we get that vaccine out?
That's a real concern. And among the different factors which might lead to a third wave, there is another factor actually, which is the fact that vaccines are coming. And my fear is that people will think, oh, look, vaccines are coming. So let's now go back rapidly to normal life. And
exactly.
This is the risk that we have to, I think it's very important that we communicate on this risk the right way.
Now, okay, these are the next few months. Then the vaccines come, say, in spring. By summer, hopefully, most of the population would be vaccinated. What do you think about the summer ahead? Should people start planning for a quasi-normal summer, shall we say?
Well, it's very difficult to predict. By the way, let me remind you that those vaccines have not been approved yet. So we don't know exactly how many vaccines we will have. And still, we don't know exactly what will be the impact in the population, especially on the older population. We have reasonable hope, as I said, to protect against the most severe cases, but still there are uncertainties. So we have to be careful in what we are saying, but I'm quite optimistic, I would say, that the summer will be a period in which we will start to live and again and enjoy life again.
Final comment, final message to the public and to policymakers. What should we do at this point to try to control the virus and see an end to this pandemic by mid-year next year?
Well, my message would be to the citizens: let's be confident in science. Let be our governments follow what science is telling us. Let's be confident that if we follow science, we will finally succeed and successfully fight this pandemic.
Dr. Goldman, founder and co-director of the I3H Institute, thank you so much for joining us on the European Health Summit. Thank you.
My pleasure.